all, welcome to today's Cancer Healing Journey Talks. Myself, Annie Jose from Community Outreach Team of ZenOnco.io and Love Heals Cancer. Cancer Healing Journey Talks helps cancer survivors and caregivers to share their journey with vast number of survivors and caregivers who have traveled or been traveling through this journey. This can inspire and motivate them for their faster recovery as well. I would like to introduce today's speaker, Jim Montenieri. He is a lymphoma cancer survivor. So over to you, Jim.
Okay. I'm a survivor still. However, I've not been cured. My kind of cancer is follicular lymphoma, and I was diagnosed with stage 4 lymphoma last year in March. It's not an aggressive form of cancer, and I've likely had it for years without knowing. But I was diagnosed by accident. I went to the hospital because I was having chest pains and thinking it was a heart attack or something. And what it turned out to actually be is the lymph node under my left arm had grown so large it was pressing on the lung, making it difficult to breathe and really causing a lot of pain. I was diagnosed. The one thing I didn't want to hear, I knew I had cancer. I mean, it was pretty much obvious at that point. The one thing I didn't want to hear is stage 4. I've lost some family members to cancer, and I knew enough to know that stage 4 was the worst kind. But that's what the diagnosis was. However, mine is an aggressive type of lymphoma, and they were giving me a good prognosis with chemo, or immunotherapy and chemo was how they chose to start treating it. Do you want to ask a question at this point, or? Okay. So follicular, I can't say that word, follicular lymphoma isn't necessarily aggressive, like I mentioned. And the goal at that point was to kind of bring it under control, shrink a lot of the lymph nodes that were swollen and reduce the activity. When doing that, they told me it wasn't curable, but it was manageable. So it's something that I will have for the rest of my life. But whether it's fully active or not, I'll have to be scanned pretty much every year for the rest of my life. That said, they elected to go with immunotherapy over just straight chemotherapy with a drug called rituximab. And I started getting a session every week and did that for, I think, 8 weeks. And then I was back to the specialist, another PET scan. At that point, with my first PET scan, it had shrunk some lymph nodes and reduced activity in some, but others were still, going strong. But one of the things about lymphoma is it compromises they had me doing immunotherapy every week for 2 months. And then they wanted to do another scan, a PET scan, to check the status. The cancer, some of the lymph nodes shrunk dramatically, and with much lowered activity in those scans. Others didn't really shrink, and one actually even grew. So at that point, what they wanted, the discussion was to do the immunotherapy combined with a chemotherapy. One of the things about lymphoma, though, is it compromises your immune system. And when you're going through immunotherapy, your immune system is compromised even more. So right now, the COVID numbers around where I live in the United States are getting a little scary in places. The newest variant of the disease, and while I am vaccinated and boosted, if I got it, I could be in danger. So rather than do the chemotherapy, what they've elected to do is just maintain treatment on a basis of once a month, or once every 3 weeks, until the numbers get better. and probably during the summer when, typically flu numbers and COVID numbers decrease. So I got to say, it's a little frustrating not being able to go through and just, get rid of it altogether, or at least bring it under control. But my outlook or my prognosis is still positive. That said, just this past week, I started getting a pain in the junction of my inner thigh and pelvis that got worse and worse. And it kind of ran down the inside of my leg as well. And my wife noticed that the area, one of the lymph nodes in my, lower abdomen or upper groin area, had been big for a while. And we were kind of used to seeing that one. However, now I had a lot of swelling inside my inner thigh. So I called the nurse, and she had me come into the oncologist's office right away. I went there yesterday now, and they're going to do, there was a PET scan scheduled for later in March. They bumped it up to tomorrow. And I guess this is a little concerning. They're talking about possibly adding the chemo now and just hoping that I don't get sick, or radiating that specific area, and then doing the chemo in the summer. There's a lot of options on the table. However, they need to identify what's going on, for sure, with a PET scan. So that was kind of a little setback. My wife didn't take it well. And that's one of the things about cancer that people don't realize. It's, for me, and I'm sure plenty of others, the worst part isn't having cancer. The worst part is what it does to your family. My parents are worried sick as it is, and she's worried sick. Our kids are, and I hate to see that. When I was in my early 20s, my mother had gotten remarried, and she was happier than I ever saw her. But within 2 years of her getting remarried, he was diagnosed, and he only lasted for about a year and a half. And I watched what it did to my mom. He wasn't my real father, but I respected the man because he treated my mother so well. And she made her so happy. And I know it was hard for me. I can't even fathom what it was like for her. And I told her, she got really upset. And that was tough. I wanted to hide it from both my parents so that they wouldn't worry until, as long as there was nothing serious. Cancer is always serious. Let me rephrase that. If I wasn't terminal, I didn't want to tell them. My wife made me, and she was right. But my mother took it hard. My father took it hard, for that matter, as well. My wife's name is Melissa, and it's funny how history can repeat itself in other ways. My wife and I got married in October of 2000, October 24th, 2020, excuse me. So we haven't even hit our second anniversary yet, but I was diagnosed 6 months later. And, we didn't even have a chance to do the newlywed first year kind of stuff, because it immediately became about that rather than our marriage. And the worst part was that our previous significant other, they were together for 8 years. He had died in rather tragic circumstances. And I wasn't the first man she dated after that. but I was one amongst the first three. And we were coworkers at the time, and we were also, good friends. But we had always thought if we ever got into a relationship with each other, we'd be a disaster as a couple. But we fell in love, and we actually worked really well as a couple. She is the strongest person I've ever met. She's been through a lot of bad stuff and, horrible stuff, as a matter of fact, in her life, and yet she keeps on going. And without her, I'd be an absolute mess. I wouldn't be able to hold it together. But she gives me the strength to keep fighting. We said in our marriage vows that we will all, if we lean on each other, neither of us will ever fall down. And but I feel like I'm, leaning on her more than she was leaning on me. I hope that I can return the favor in some other way other than her getting sick. I hope I can be there for her, to kind of pay her back for this, because, after the first 6 months of being married, everything kind of became about me. And I would so much rather have it be the other way around. I have the easy job. It's harder on my family than it is on me. I've always been a survivor myself. I've gone through some pretty terrible stuff myself. Sorry. I've been a survivor my entire life, and I don't doubt that I'm going to beat this, or at least, if not beat it, since it can't be cured, not let it kill me until it's my time to go. When you have cancer, it's not. There was a star at ESPN, the network, on SportsCenter, named Stuart Scott, and he gave a speech. Wait, why is that doing that? Are you hearing an echo?
Yeah, I can.
Okay, sorry. I don't know how to fix that, but
That's right.
he gave a speech saying that if you die from cancer, cancer didn't beat you. You win with cancer by how you love, how you live, and how you define yourself, other than being a cancer patient. And I've always took that to heart, but not only am I going to, will I fight for my own life, but I'm not going to put my mom through having to bury her son, or either of my parents, but my mom especially. And I'm not going to let Melissa die, have to bury another husband so soon. She puts on a brave face for me all the time. She doesn't often let it show how much she worries, how hard it is. But ever since we've been friends, I've always been able to read her like a book. And as best as she tries to keep a brave face and take news in stride rather than let it really get to her, but I can see right through that. And another thing about the family is your family is always going to love you. Your friends are going to, and I define family as blood relatives as well as family we choose. I have some of the best friends that a man could ever ask for. And they're always going to love you. And one of the hardest things to do in life is to watch a loved one go through something like this and not be able to fix it, not be able to get rid of the cancer for you, I would much rather me have cancer than my wife, because I think I have the easier job. And her strength is just amazing. Do you have any questions at this point, or
No, so
anywhere you want?
no, I do have a question. So how were you able to cope up with all these emotional things which were going on in your life at that moment? So how are you able to manage all these things?
Okay. Yeah. The around here we have Atrium Health. That's a healthcare system of multiple hospitals, practices, and have all the treatments in the world, as far as they have orthopedic doctors and heart doctors and cancer doctors, obviously, and the cancers actually treated by them with a special organization within their organization called Levine Cancer Institute, LCI for short. And when I got diagnosed, I had been laid off because business was down for COVID. So I didn't have insurance. And I've applied for Medicaid and disability until I can go back to work. And the reason I'm holding off now is that if I were to get sick, it would be very dangerous. So I've done some consulting here and there, but I don't have insurance. And yet they are treating me so much better than I would have thought. They gave me, I had lost, when before I got diagnosed, I had lost close to 50 pounds without trying. And, at that point, it was almost positive. I was almost positive that, something was seriously wrong. I had a lot of nausea and vomiting and no appetite. So when I lost all that weight, one of their main goals was to get me back up to a healthy weight after starting treatment. I think you're frozen. Can you see and hear me all right?
Yeah.
Are you?
Yeah, I'm here. Okay.
Okay, I'm sorry. On my screen, you're frozen. But I'll just continue. So not only do they assign me an oncologist, but they also assigned me a lymphoma specialist to oversee the oncologist. They assigned me a nurse that is my point of contact for anything. I have her direct line to her cell phone, and as long as she's not with the patient in person, she picks up. They assigned me a therapist as well as a psychiatrist that specialize in how the needs of cancer patients, as far as mentally, emotionally, spiritually, as well as treating things like depression and generalized anxiety disorder and everything else. I've been treated for depression since I was 16 years old, and generally medication keeps it, at bay. That doesn't mean that I don't feel sadness, don't feel the hurt. I just am not consumed by it. So I would say that they're a big part of it. My therapist, Claire, and my psychiatrist, Dr. Romeo, have helped quite a bit with that. Another thing that's helped so much, like I have already referenced, is my wife. Without her, I think I'd be lost. And I sure as hell wouldn't be able to keep track of all my appointments. I have so many doctor's appointments. It could almost be a full-time job, but I don't know that I'd be able to fight if it weren't for her. But what I do for, what makes life worth fighting for, is your loved ones. And one thing that I was always told, let me step back a second and say, I'm in recovery. I have been a recovering alcoholic addict, been in recovery over 10 years. And one of the things that, the 12-step fellowships taught me was that if you're going through something and you can't see a reason why, you can always focus on it. Someday you're going to be able to help somebody else get through that exact same thing. That experience is, while it can be horrible, might help another person down the road. And that's one of the things about the fellowships is they talk about helping others and how that's spiritually uplifting for yourself. So I do that as much as I can. I can't go and volunteer down at the shelter because of the risk of getting sick, but I do mentor some young people, and not only in recovery but in life as best I can, and I try to be there for others as much as I possibly can. Now it's limited now, but that doesn't mean I can't do. That doesn't mean that there's nothing I can do. There's always a way to help somebody. There's always a way we can help others. I focused a lot on kindness. I'm sorry.
No, I was just saying that. Yeah. Please continue.
I'm sorry, you cut out for a second. I apologize. Can you say that again?
All right, I was just saying that that was indeed a great thing you're doing. So you can continue.
Thank you. But it's not about me, really. But I've there's been days where I have left chemotherapy or immunotherapy chemo with just nothing left, being physically exhausted, but as well as spiritually and emotionally drained. And I was stopping at the grocery store if I was feeling up to it, if I wasn't throwing up. And sometimes all it would take is another person to smile at me for me to feel better. And I've come to understand that kindness is the easiest and perhaps the most effective way that we can change the world. You never know when your kindness might give somebody the strength to keep fighting themselves. So that's been a big part of how I focus on things, is just being kind to others, being patient with others, even though I don't necessarily want to. That in turn has made me happier. I read a lot. That's another one of my escapes, is I love escaping into a book. I'm also a movie buff. Love books, love movies, love sports. And sometimes those are the escapes that I need when I just don't have much left to give that day. I can escape into one of those. My family is everything to me, and sometimes initially everyone was kind of walking around in eggshells around me. We don't want to upset Jim. We don't want to make things harder for him. But that's not the way the world works. The world can be a cruel and unfair place, and not everyone's going to try not to upset you because they know you're going through something. So I've urged them, and it's working now, that don't treat me like a delicate piece of crystal. I'm not going to shatter just because you get upset. It's my job to be there for the kids, not the other way around. And slowly they've gotten back into that habit. I love spending time with my stepson. He reminds me of myself at that age, almost too much. My stepdaughter is going to be getting married next year. So proud of her. And My daughter is going into her junior year. She'll be going into her junior year of high school next year. Those are the things that make it worth fighting for, to me, as your friends and your family. My friend Kyle he's helped me out a little bit financially, but he's also been there for me to vent on. Sometimes the frustration just starts to build and build and build, and you need an outlet for it. Exercising is one outlet that's really healthy for you, but talking to somebody is even more beneficial. The more I hold things in, the more they build up, and the worse it is when they come out. That's the problem with trauma and sadness and frustration, fear and anger, is they're going to come out whether you like it or not, but you can choose how, when, and to whom they come out to. I yelled at my wife one day, and she didn't deserve it. She did nothing wrong. And it didn't take me long to realize that. But that was a week where there were some other things going on in the family, and I hadn't had a chance to vent to anybody, and that's how it came out. And while she understands and knows that I'm not one that yells a lot or gets really angry a lot, but she understood that it wasn't about her. I wasn't yelling at her. I was yelling at the world, and she just happened to be there. The other thing I have, and I have to mention this, is we have 3 dogs, and they keep me company during the day while my wife is at work. And my son is there at work or school. Can we take a break? I need to blow my nose. Dogs, though, we have 3 of them. One's just a little over a year old now. The other one is the next one up is I think 3.5 years old now. And then we have an older dog named Sadie, who is she's the boss. But so I spend a lot of time at home during the day and by myself, and that can wear on you mentally as well. I know it wears on me. So I talk to the dogs all day long, and this might mean I'm a little mentally ill, but they all had their own voices in my head. I talk to them, and I even imagine their reply to me. But we have some of the funniest, most loving dogs anyone could ask for. We had 2. We weren't looking for another one, but there was one found near where I live that was chained outside, and no one was living at the house. So we adopted him, give him a better home. And he is easily the funniest dog that you can ask for. And that's another thing that helps with having the strength to fight, is you have to have a sense of humor. Laughter, other than crying, laughter is one of the best outlets of pain and fear, doubt, sadness that you could ask for. It's cathartic. It cleanses you. And so I try to make sure I laugh every day at something, whether it's the dogs, or if I'm watching a movie. I tend to watch more comedies now than anything else, simply because I need that laughter. But the number one source of my laughter is my wife. We make each other laugh a lot, and that's one of the reasons our relationship works as well as it does, our marriage, is because we have that sense of humor in each of us, where we make each other laugh on a consistent basis. Laughter is, they say laughter is the best medicine. I've come to discover why they say that. It's a saying because it's a real thing. So Laughter to me is one of the easiest outlets for the pain or the frustration, the sadness, the fear. It's hard to feel those things when you're laughing at something, and sometimes it's not really that funny. But because your mind is telling you it needs an outlet for what it's feeling, it becomes that much funnier to me, I should say. And it's a big part of how I've been able to maintain a relatively healthy mental, emotional, and spiritual state. I do go to church. That didn't start with the cancer. That had been something that I had done ever since I got sober. And that helps nourish me spiritually. And as I referenced earlier, helping others and volunteering when I can helps me spiritually as well. There's been times where I've got completely emotionally, spiritually bankrupt and nothing left. But between family, my friends, helping others, being kind, laughing, I've been able to continue to go because they replenish me emotionally and spiritually and physically to a degree. It's hard to talk to your husband or wife or significant other about end-of-life directives and what you would want them to do, what you wouldn't want them to do. She has medical power of attorney, and her and I have a very clear understanding of what I want and what I don't want, for that matter. At first, I thought that talking about dying and planning for that was self-defeating. However, I've come to understand that it's not self-defeating because you get to have a choice if you're unable mentally to make a choice. You already have it on record as to what you want, and that gives me a lot of peace of mind. I know that if I were to go, my family would be okay, and that I would have my wishes as far as cremation, burial, all that respected. But again, I have a good prognosis that I'll live a relatively normal life once it's under control, and it's not curable, but it's manageable. Only thing is, though, is the one thing that I haven't got a clear answer on from them is this kind of cancer generally happens in somebody who is 60 years old or older, not for someone who's only 45. And so I know that, excuse you, I know that, the average life, the people have a tendency to live more than 10 years with this type of cancer. But I don't know if it's going to be taking time off the end of my life. I don't know if it's gonna shorten my life significantly or not. But I try not to think about that as much as instead of wondering what time it could take off, I try to focus on what I can do with the time I do have. Cancer puts a lot of things in perspective and gives you perspective on life that you didn't quite have. Having substance abuse issues over the years, there were plenty of times I wanted to die because I was so miserable, and I had so much regret and remorse about the way I was, the way I acted, what I did to my family and friends. Now it seems silly. No, that misery is real, but life is short and it's not guaranteed. And I'm sorry. No, sir. Hush. Sorry, the dogs. One of them was about to start barking. Come over here. It puts into perspective the precious time that you do have left. I didn't have a great relationship with my father when I was younger. Actually, even as an adult, there was a lot of trauma from my childhood. He came back from the Vietnam War, not mentally right, and with violence and anger, rage. And I think, I've never asked him directly, but I think it's likely has something to do with something he had to do to survive that war and is proud of. I think it tears him apart inside. But one of the best things that I've done for myself is to let go of those resentments and anger towards people, and try to, if I'm going to die at some point, I want it to be on my terms as far as where my relationships stand. Relationship with my family, my friends, my parents, my wife, my kids. And he is now my best friend. Now, that didn't start with the cancer. It started with him getting a divorce, moving out, and I was really worried because he had, mental health issues when he was, when I was 16 years old. And so I was worried about what he might do. My wife and I started going down there to visit him every other weekend, about a 4-hour drive from here. And what I had started right around, just before COVID started. At first I was just so grateful that we could put all that stuff behind us and have that relationship that we never had, in case he were to pass away. But I'm glad also that I have it in case this does get the best of me. Excuse me. Okay. Just adjust. So I have relationships with family members that I have, haven't been good for a long time, and I've gone about setting as much as I can right on those circumstances because if I were to go, I'd rather, if you ask me whether holding on to resentment towards a family member or forgiving and having a relationship with them, once again, I'm going to choose the latter of the two. And connecting with my father, and he's now, one of my best friends. We talk about everything. And he's helped quite a bit, financially. We're not, neither my wife or I made enough money to be the sole breadwinner in the family. So it's been, we'd have to get creative financially, quite creative. And he's also helped with that. And I'm not a man that likes asking for help. I grew up, my father and my grandparents were both Sicilian. My father was second generation, born here in the States. And one of the things about the Sicilian culture is, you don't show weakness, you don't show pain or fear, and you hold on to your pride. So asking for help does not come naturally to me. I've always been, even if I just had the flu, I wasn't one that wanted people to take care of me. I can get up and get my own drink. I can get up and cook my own meal, and so this has really made me have to let go of that tendency and to let people take care of me when I can't keep fighting for that day, The days that I don't feel like fighting, my wife fights for me, or one of my parents fights for me, until I've replenished myself with rest. And that's another thing that has been a difficulty, but also an asset at times, is I've always been one that goes to bed around 11 o'clock at night and wakes up at 6 a.m. the next morning. I was always an early bird, but they've stressed with me that I need to get rest. That's one of the best things I can do for my body. And there are days where I can sleep 18 hours, not all at one stretch, but 18 out of the 24 hours. And then there are other days where I get maybe 4 hours of sleep, and I can't detect a pattern on when is when. I thought at first it was, the chemo wiped me out, so I had a tendency to sleep a lot that for the following few days. But I can't discern a pattern, and getting rest is something that's been a challenge. And there's also the feeling that even though I don't have a terminal diagnosis, I don't want to waste any time I do have sleeping. I'd rather live and be with family, do the things that make I enjoy. But the doctors have really beat that into my skull that I need to get as much rest as is healthy. So I've had to start taking a medication that helps me fall asleep at night, but also helps keep me asleep throughout the night. And as someone who's in recovery from substance abuse issues, that's scary to me, because I don't like being dependent on a drug for something so fundamental as sleep. But we've tried to go with a medication that isn't supposed to be for me. That said, it's still leaving me. It frightens me to have to rely on something for something as simple as falling asleep and getting rest. Before cancer, I had other health issues. I had high blood pressure. However, when I lost all that weight from the cancer, my blood pressure actually normalized quite well. So they told me I could not take blood pressure medications anymore, at least until something changed. But I have I can't say the word. The discs in between my vertebra deteriorate over time, much more than the average person. So I've had chronic back issues with chronic pain for the last 15 years, really. And when you live every day in pain, no matter what you do feel pain. Sometimes it's horrible, sometimes it's tolerable, but it exhausts you. It makes everything that you do harder. And I don't like taking pain medication because I like taking pain medication too much. So I try to avoid painkillers, but another thing they've drilled into my head is that if you're fighting pain, your body doesn't work as well. It exhausts your body. So I've had to be put on pain medication, not only for my back, but where the discs are swollen. It's pressing on a tendon or a nerve or whatever. There is pain associated with it. And they've told me that you have to treat the pain in order to fight the cancer to the best of your ability. No one ever told me that life was going to be painless, so I've avoided that until recently. And it's, I might not need this much, but my wife and I have an understanding. She gives me the pain medication. It's kept in safe that I do not have the combination for. And I only take as much as I absolutely have to, and don't refill it nearly as often as I'm allowed to. It's something that I have to be very, very careful, because if I start falling back into substance abuse issues, that would end my marriage. I told her the day after I proposed to her that if I was to start doing drugs again, that she has to kick me out of the house and divorce me, because I go from being a really, generally a really good person to being a horrible human being. And I do it that quick. So she holds on to them for me. I have accountability with her. I have accountability to the hospice or palliative care nurse, my doctor, and I have a contract actually with the palliative care that I am not allowed to fill any other prescriptions for any other kind of pain meds without their express approval. I had surgery just 4 weeks ago now, about a month ago. It was supposed to be a simple procedure, but it turned out I had ruptured a bunch of tendons in my wrist and my hand, and they had to be repaired surgically. And that was very, very painful. So when they prescribed pain meds that were even stronger than what I have available to me, the first thing I did was, call palliative care. And they know, I think they know at this point that I will do what I'm supposed to do. But I need that accountability to maintain that. But in addition to that, right now alone, I have not only is the pain in my leg and groin from the swollen lymph node, I have a disc that is, I have a total of 3 different discs that are herniated in my back, ruptured, or 2 on my lower back, 1 in my neck. I have, I'm going through kidney stones right now, which, for any man that happens to watch this, is horrible. So, and then I have healing from this. I'm going to start physical therapy on this. So I've had a lot of health issues on top of this. And if I had known I was going to live as long as I did when I was younger, I would have taken better care of my body. But I didn't, and I'm paying the price for it now. I've got arthritis in both my knees and in my left hand. And that's something that runs in my family and will only get worse. There's not a man in my father's side of the family that hasn't had at least 1 knee replacement. Most have had 2 and a hip replacement. My grandmother had hip replacement twice. The second one killed her. And so I have that to look forward to. One of the things that, has been an adjustment is blending Eastern medicine and Western medicine to be more holistic in how you maintain health, how I maintain health. I'd always been one that, if that medication is something, medication is made for those things. But I've come to discover that acupuncture is remarkably helpful. Yoga, which is pretty difficult because of my back, but it helps stretch my spine out, and that helps with the pain. These are things that I wouldn't have even considered 20 years ago, 15 years ago. But they're a part of, they complement the Western medicine to make a holistic treatment for not only the cancer, but for the chronic pain and everything. Acupuncture is wondrous. I would have never thought that it would help as much as it does. And it's an important piece of the whole pie of how I'm getting treated and how I'm treating myself. I need to eat better. I haven't come across a candy or a cookie that I didn't like. But I'm trying to get better at putting healthy stuff in my body. I haven't quit the junk food, but I only allow myself junk food if I have something healthy that day too. So there's always fruit in the house, and that seems so simple, but for someone who I lived alone. I'd never been married before my wife. I'd been engaged once, but my Melissa was the first person I actually really considered marrying, that I really wanted to marry, and didn't have much doubt at all. So I've been used to having things my way, and my idea of a dinner was, I know, mind you, I can cook, and that's another thing that I do to enjoy myself, is I enjoy cooking. But when I lived alone, felt like it was too much effort and too much wasted food to cook for just myself. But now I have, others to cook for. So when I was single, I ate, a piece of pizza, 3 Oreos, or 3 or 4 Oreos dunked in milk, and washed it down with brownies. It wasn't healthy at all. So I try to make sure that I get a vegetable every day, at least one vegetable, and get a piece of fruit every day, be it bananas or anything else. That's another part of what gives me the strength to keep going. I hope to one day update you and say that my cancer is completely in remission for now, and that I've gone back to work and I feel better and everything is wonderful. But I can't be sure of that. What I can be sure of is that I will treasure the time I still have. And like I said, I'm not terminal. I don't have a terminal diagnosis. But cancer was the first thing that really made me contemplate my mortality. I often consider myself 10 feet tall and bulletproof. And now I'm starting to think otherwise. And so instead of it consuming me with fear of the future, fear of what might happen, could happen, or fear of what won't happen because of cancer or any other health issue, is to pack as much life into what I have, the time I have left. Whether it's 30 years from now and I'm 75 years old or older. The men in my family have a tendency to live until they're not into their 90s. Or if it's 10 years from now. There's so much still I have left on my bucket list, and that's one other thing that I've actually made a list of things that I want to do before I go. I don't know where I'll get the money to do a lot of them, unless I strike it rich somehow. I don't know how that would happen, but I have a list of things that I want to do before I go, and travel is something that I enjoy immensely. I've been to more than half of the United States at one point or another, and I love traveling because there's so much in this country. It's so big, there's so much to see, but I've never traveled internationally, so that's something that's big on my list. I want to go to Africa. I want to go to Europe, Eastern and Western. There's so much history and beauty on this on this world that I want to see as much as I can. Oh, one other thing that I left out as far as what keeps me going is when I was in high school, school always came very easily to me. I didn't really have to, I didn't struggle with grades. I was able to get A's and B's without trying much at all. But I was in such a hurry to grow up and be a grown up and make money and everything that, I never even finished college, even though I had gotten an academic scholarship. But now I've found this love of learning. I watch more documentaries than any other kind of show or anything else on TV. I like reading nonfiction as well as fiction. I love to learn, and so I've fed that curiosity, learning about subjects that interest me. Several branches of science I'm fascinated with. History I'm fascinated with. So I have nourished that and fed that thirst for learning, for knowledge, and keeping myself mentally engaged. That helps me keep me mentally engaged. Alzheimer's does run in my family, and my biggest fear is not my mind not being something I can rely on. So with the time I do have, and with the healthy mind, I'd like to learn as much as possible about everything. And that is turned into a daily source of enjoyment. I'm kind of running out of things to say. Would you like to ask a question?
No, that's all. I think you have answered all the questions. So thank you so much, Jim, for the wonderful sessions. I'm pretty sure that, and I'm really glad that I am able to listen to you. And it was a really long journey, and it was just a roller coaster. So it was completely an emotional roller coaster. So thank you so much for sharing your journey with us. And I'm also sure that lots of other survivors and caregivers will be benefited from this session as well. So thank you so much, Jim, once again.
All right, thank you very much. Wise man once told me, my grandfather, when I was much younger, to really understand is that to have a beautiful life, you need to find the beauty in every day. And sometimes that can be hard. We're in the middle of winter right now, and the trees are bare. It's not pretty. If there was snow, it would be pretty, but we're just, dark gray and damp today. And but there's always beauty. Beauty isn't always visually beautiful, but you can find beauty in the way people treat others. You can find beauty in just about anything if you look. One of the things that I've done, and it started off as more of a way to remind myself to find the beauty in every day, but it's turned into a full-fledged hobby, is photography. Now I don't have, a $1,000 or $2,000 camera that most serious photographers would have. But I do have a nice camera, but since I can't always carry that with me, I've learned how to use the iPhone to take really good pictures. One of the things that I love most is sunsets and sunrises, and I love the beach. So people have started to tell me that I should sell some of these pictures because they're that good, and I don't know about all that. I'm not in it for money or profit. I was in it for that simple, edict that my grandfather gave me, that you have to find the beauty in every day. So I'll share some of those.
Thank you so much, Jim.